Today being 65th day of Swasthya 365 day project, I am here with you to discuss about vitamin D. Now, as you know, in the current pandemic situation, vitamin D is one of the supplement used to recover from the disease. Vitamin D is a fat-soluble vitamin needed for health and maintain the strong bones. It helps in absorption and distribution of calcium and phosphorus in our bodies. Also, it prevents loss of bone mass, stimulate nerve conduction, and acts as an immune booster. There are the three ways where we can get vitamin D. Sun. Sun is known as sunshine vitamin. Our skin converts sunlight into vitamin D, but this might not be good source if you live in a high altitude. And diet. Fatty fish such as salmon, mackerel are among the best source of vitamin D. Beef liver, cheese, and egg yolk provide small amounts. Mushrooms grown under the UV lights, fortified foods provide most of the vitamin D in our diets. Next we move on to the requirement. Newborn baby needs 400 IU per day, adult needs 800 to 2000 IU per day. Who needs supplement? Elders, newborns, dark skinned individuals, certain medical conditions, liver disease, cystic fibrosis, celiac disease, and Crohn's disease, and those who are with obesity and have a gastric bypass surgery. Diseases caused by the deficiency of vitamin D. There are two main diseases caused by deficiency of vitamin D: osteoporosis in adult and rickets in children. Osteoporosis in adult. Osteoporosis causes a bone to become weak and brittle, and fall or even mild stresses such as bending over or coughing can cause a fracture. Osteoporosis related fractures most commonly occur in the hip or wrist or spine. Pathophysiology. Our bones are in the constant state of renewal. New bone is made and old bone is broken down. As age advances, bone mass is lost faster and it's created. Risk factors. Women, especially postmenopausal, are at the higher risk. Elderly, race, white or Asian descent. Family history. Small body frames tend to have a higher risk. Low estrogen in postmenopausal women and women who are treated for breast cancer. Low testosterone in elderly male and men who are treated for prostatic cancer. And high thyroid hormone therapy and overactive parathyroid and adrenal gland. Low calcium intake and severely restricting food intake. Gastrointestinal surgery to reduce the size of stomach or to remove a part of intestine. Long-term use of corticosteroid. Next we move on to the medical problems. Celiac disease, inflammatory bowel disease, and kidney or liver disease, cancer, multiple myeloma, rheumatoid arthritis, and sedentary lifestyle and excessive alcohol consumption. So next we move on to the complications. Compression fractures. Hip fractures often increase risk of death within a first year after the injury. Next is the prevention. Good nutrition and regular exercise are essential for keeping your bones healthy throughout your life. Bone weight. Being underweight increases the chance of bone loss and fractures. Excess weight is also known to increase the risk factors of fractures. Maintaining an appropriate body weight is good for bones. Calcium requirement. 1 gram per day need for adult. Men more than 70 years and women more than 50 years need 1.2 gram per day. Good source of calcium include low-fat dairy products, dark green leafy vegetables, and soya products, calcium fortified cereals and orange juice. And exercise can help you to build a strong bones and slow bone loss. Strengthening training helps strengthening muscles and bones in the arms and upper spine. Weight bearing exercise such as walking, jogging, running helps mainly the bones in your legs, hips and lower spine. Balances exercise such as Tai Chi can reduce your risk of falling, especially when you get older. Swimming, cycling and exercising on missions can provide a good cardiovascular workout, but they don't improve your bone health. Next we move on to the second disease, rickets in children. Rickets is a softening and weakening of bones in children, usually because of extreme and prolonged vitamin D deficiency. Rare inherited problem also can cause rickets, which is related to the low level of phosphorus. Next we move on to the signs and symptoms of rickets. Delayed growth, delayed motor skills, pain in the spine, pelvis, legs and muscle weakness, and skeletal deformities like bowed legs or knock knees, and thickened wrist and ankles, chest deformity. Next we move on to the risk factors of rickets. Dark skin has more of pigment melanin, and which lowers the skin ability to produce vitamin D from sunlight. Mother's vitamin D deficiency during pregnancy, children who live in a higher altitude or higher risk of rickets, premature baby because they had less time to receive a vitamin from their mother in womb, and anti-seizure and antiretroviral medications, exclusive breastfeeding child. Complications: failure to growth and abnormal curved spine, bone deformities, dental defects and seizures. Next we move on to the prevention of rickets. Exposure to high sunlight provides the best source of vitamin D. During most seasons, 10 to 15 minutes of exposure to the sun, and overexposure may cause skin cancer. Appropriate food contain vitamin D or that can have a fortified with vitamin D. Pregnant lady should take vitamin D supplements as per the doctor's advice. Next we move on to the treatment of rickets. Vitamin D or calcium supplements corrects the bone problems associated with rickets. Treatment for underlying medical problems and some skeletal deformities require corrective surgery. Thank you for your patient listening.